is formally called the Bronx Community Health Leaders, BXCHL. Remember that. Some of whom are the first in their families to attend college, and they gather every Tuesday to discuss their dreams of becoming doctors and how they will improve the Bronx's residents' wellness and their experience receiving care. So here to tell us more is Julissa Dela Cruz and Verena Clark from the Bronx Community Health Bronx Community. Welcome. I'm getting there, right? Okay, so tell me, what is it? What is this program?
Sure.
And what do they do?
So the Bronx Community Health Leaders is a peer support group for Bronx-based college and post-bac students who are interested in pursuing a career in healthcare.
Okay.
And our mission, we have a twofold mission. First is to provide resources and opportunities for underrepresented minorities in medicine, because there aren't too many available for us.
Right.
These include volunteering and a lot of guidance, mentoring, and academic support.
Okay.
And the second part of our mission is really to support our community. We volunteer in the Family Health Center, which is on Fordham Road. And most of us are from the surrounding neighborhood, and we really want to help support the clinic, but also the community around us.
That's awesome. So who are the leaders? Can anybody join? What are the prerequisites to become a health community leader?
So you must be over 18.
Okay.
And you must be either in college or have graduated college.
Okay.
So we have a lot of members who graduated college, have taken some time off to figure out what they want to do. So we have a lot of those that we kind of provide some mentoring and guidance for in just a space.
So talk to me about how you plan to improve Bronx wellness. We're in the poorest county health-wise,
Yes.
right?
Yes.
And I've lived in the Bronx, for the better part of my life, and it's always been that way. So what are we doing to change that, or what are you hoping to do to change that? Maybe you want to.
Sure. So what I love most about Bronx Community Health Leaders is it's about lifting the communities and lifting the community around us and making sure that we're, exposing our patients to health and wellness. And so us as leaders, we really have the opportunity to work alongside the clinicians and the staff at the Family Health Center to help increase the health education within the clinic, promote health and wellness, and ultimately combat the health disparities of our patient population. And so through clinic initiatives, projects, and programs within the clinic, both the leaders and the clinicians within the staff at the Family Health Center really work hand in hand to help promote that health and wellness for the patients.
Talk to me about that relationship with the clinician and you guys in there, because in a sense you're almost like interns working in there, right? So you're volunteering, and so you're with the professionals, and we have a lot of interns here. How are you finding the relationship with the clinicians? Like, are they helpful to you in what you want to do, and are you being helpful to them in reaching this community, because it is your community, right?
Definitely. Yes. It's a great relationship. As you said yourself, most of us are the first in our families to go to college. So we really don't have that mentoring and that guidance from someone who knows and who's close to us, who has been through the process to where we want to be, those physicians, those clinicians. So it's really great that we get them as mentors to help guide us and to give us feedback and advice. And then in exchange, we do help a lot around the clinic. We do, like she mentioned, patient education is a big thing that we tackle. And we do that by doing presentations in the waiting rooms. We made a newsletter, the first newsletter at the clinic, to distribute to the patients. And we have a board that Verena has actually been very instrumental in changing every month and including information that really helps patients. So there's a lot of, it's a really great relationship between the staff, the physicians, and the volunteers.
So what do you think is what's the biggest health challenge you see in the health center? You're there, like people coming in, like what's the most common thing that you're looking at?
I would say, as far as the disparities that we see within the patients in regards to diabetes or health, heart issues, those are the most prevalent health issues that we see. And working with the physicians to help increase that education and awareness within the patients. As we said before, some patients, you know, some of the issues are genetic, and so having that knowledge on how to combat and overcome and to make lifestyle changes has been truly a process.
Yes.
And working with the physicians, we're able to see how they work with their patients, but also we become, you know, we become people who can work with the patients, and they can see a young face and be willing to share their stories, and we can develop that awareness.
And I would imagine culturally it must be difficult to make health choices, because I can think about what I ate growing up, and what some, you know, and a lot of these families are immigrant families, so their food choices probably are not. So do you find that you're helpful in that process because you're like in there with them, kind of thing?
Exactly.
You're their face, in a way.
Right.
So so talk to me about what it's like to be in this program while you're in med school. I mean, you're about to start, right?
Yes, I'll start in a few weeks at UCLA.
Okay, and then will you still be part of this program? How does that work
From
for you?
afar. I've spent the last year working with Julissa and the rest of the leaders, and it's been a great opportunity. And so I will continue to mentor the other students, because again, we do help within the Family Health Center, but we also are a student support group. And so I'll be doing that at UCLA, and Julissa will still be out and about.
So how is it in med school doing this, volunteering and being in med school? I mean, that's a pretty big commitment.
It's a lot. I was promoted to co-director of the program, so it's a lot of responsibility, but it's something that I'm so passionate about. It really gives me so much motivation. We really are family, and it's just an amazing group. So I'm very motivated to do this.
If somebody came to you, say I wanted to become a doctor now, why are you doing it? What would your answer to me be?
Why be a doctor?
No, why are you doing this program? Like, why put yourself through this, being a co-director, doing all this volunteering? Why? What's the core reason for you?
When we started it, it was out of a need. We don't have many opportunities, many resources. As underrepresented minorities, as Bronx residents, as coming from immigrant families, there really aren't too many things out there for us. So because I felt that need, and I felt that there was just something that was lacking in not just in my not background, but in the things that I had available. So I knew that this was something that also people similar to myself, like Verena, like many of the others leaders, could benefit from.
That's awesome. Good luck. Good luck to you.
Thank
Good
you
luck
so
in
much.
UCLA.
Thank
Come back
you.
to the Bronx, because we
Yes.
need you, okay? So don't go away. All right, so our BronxNet, thank you ladies. Our BronxNet cameras were at the first annual AARK picnic. AARKK is an organization that focuses on giving our youth a brighter future. So BronxNet reporter Christina Pagan went out there to find out more.